Today we are going to see about scalp. So what is scalp? Scalp is the soft tissue covering the vault of skull. Next we will see the extent of the scalp. The scalp extends anteriorly up to the eyebrows and it extends posteriorly up to the superior nuchal lines. Laterally it extends each side up to the superior temporal line. Next there are layers of the scalp. Okay, now we are going to learn how to draw the layers of the scalp. So first, draw a thin double line. Then draw a bigger double line. Then third double line should be bigger than the second one. Okay, so first draw like this. Now draw a double line on the third line. Now mark S, C, A, L and P. Now we are going to draw circles. So start drawing circles here. Okay, now we are going to draw horizontal short lines. The next layer we are going to draw dotted lines. Next layer, draw dots. So next what I'm going to do is we are going to mark the artery and veins. So this one is artery. Leave one space between each circle. That space is filled by vein, blue color. Now what is this? Hair follicle. Now draw a V-shaped funnel like to the down. Okay, so now let's see the layers. So the first layer is, what is this? Skin. So the skin here in the scalp is thick and it consists of hair follicles and a large number of sebaceous glands. So the next layer is connective tissue. The connective tissue is the superficial fascia. It consists of artery, vein. That means the walls of the vessels are adherent to the fibrous network, which means when the blood vessels are torn, there will be profuse bleeding. So the next layer is aponeurosis. This aponeurosis layer is formed by occipitofrontalis muscle. I will explain about this muscle later. The next layer is loose areolar tissue. This layer is traversed by, what is this? This is emissary vein. So the loose areolar tissue is traversed by emissary vein. Then the fifth layer, it is the pericranium. What is pericranium? The fifth layer of scalp, it is formed by the periosteum of the bones of vault of skull. It is called as pericranium. Okay, so in this diagram, I have left this. Just mark a vein like this and that is diploic vein. Okay. Next, we are going to see about occipitofrontalis muscle. So this is the muscle that is forming the aponeurosis in the layer of the scalp. So the muscle has 4 small bellies. There are 2 frontal bellies and 2 occipital bellies. The main nerve supply of this muscle is facial nerve. We will see the nerve supply of the scalp. Nerve supply can be divided into sensory and motor. So sensory, first nerves in front of the auricle, then behind the auricle. So in front of the auricle is trigeminal, behind the auricle is second and third cervical nerves. Similarly for motor, in front of the ear is temporal branch of facial nerve and behind the ear is posterior auricular branch of facial nerve. Now we will see the arterial supply of the scalp. So to remember the arterial supply, we have a mnemonic here. Troch hits supra in the orbit and in the back of ear and head because he was super angry. So the arteries are supratrochlear and supraorbital. It comes from the first line. Then for posterior auricular, so what is the meaning of back? Posterior. Ear means auricle. So posterior auricular. Then head. So for head, you will remember occipital. Then he was super angry. So for that you remember superficial temporal. For angry, remember temper, so superficial temporal. So for venous drainage, the veins accompany the arteries and they have similar names. That means supratrochlear and supraorbital vein, posterior auricular vein, occipital vein, then superficial temporal vein. Then there are emissary veins in the region of the scalp. There are 2, parietal emissary vein and mastoid emissary vein. Finally, we will see about the lymphatic drainage of the scalp. So scalp can be divided into anterior part and posterior part. The anterior part is drained by preauricular lymph nodes except the lower part of forehead. The posterior part is drained by posterior auricular lymph nodes and occipital lymph nodes.